Hello guys. So in this slide, I'm going to show you how physicians think about sugar goals. So sugar goals should be tailored, should be customized, should be individualized for the patient. And so on the left here, all these are the factors that we think about as physicians that help our decision. And on the right here is the A1C. And these little green cylinders, if they're on the left-hand side, we should aim for a lower A1C. If they're on the right, we should aim for a higher A1C. So for each of these factors, we can move around these cylinders, and then, at the end of it, we can kind of see where we are and say, for this patient, we should aim for a lower A1C or a higher A1C. So let's get started here. So for the first one, are you going to get low blood sugar? So if you're a patient that's going to be a high risk factor for getting lows, we're gonna aim for a higher A1C. But if you're not going to get a lot of lows, then we're going to be like, well, it's okay. Let's aim for a lower A1C. Next is the years of diabetes. If you just got diagnosed with diabetes, and this is all relative, but within 10 years, we're going to aim for a lower A1C. If you've had diabetes for 10, 15, 20 years, we're going to aim for a higher A1C. Life expectancy. You have cancer. Are you not going to live as long? Are you in a nursing home, etc.? Or are you, young and healthy and going to live for a long time? Then we'll aim for a lower or higher A1C based on life expectancy. You have other conditions. For example, you have congestive heart failure, COPD, Crohn's disease, lupus, other chronic diseases. If you have that, then, and if they're severe, then we're going to aim for a higher A1C. But if you're relatively healthy and no other conditions, then we're going to aim for a lower A1C. Have you had an amputation? Do you have neuropathy? Do you have other vascular complications? If you do, then we're going to aim for a higher A1C. If you don't have any other vascular disease or complications, then we're going to aim for a lower A1C. So these five, you really can't change. You can't change the number of years that you've had diabetes. You can't change other conditions or some of these risk factors. But these last two we can change. So this is your attitude. So patient attitude and expected treatment efforts. So if you're very motivated and compliant and take care of yourself, then we're going to aim for a tighter A1C. But if you don't really care, if you're not motivated, if you don't do what we tell you, then we're not going to get anywhere, and then it's okay for these patients to have a high A1C. Resources and support system. Do you have a lot of family or friend support? And if you do, and if it's available, then we're going to aim for a lower A1C. But if you don't have friend, family, medication coverage, etc., then we're gonna have to aim for a higher A1C. So you kind of take all these factors and see where you are, and to kind of take the average of these, and take a look at the overall patient. So so for this patient, we're going to aim for A1C less than 7, maybe 6.5, or whatever you deem necessary. And it's very subjective on what number you use. And if all these green bars are to the right, then we're going to say, we're going to aim for a higher A1C. And again, that could be 7.5, it could be 8. It really depends on the patient. So these are the factors, and these are the things that we think about as physicians when we come up with your A1C goals.